Hi YouTube, it's Kim here today, and this is Simplified Medicine. Today we're going to talk about kidney stones. The definition of kidney stones, it just means stones literally inside the kidney. So the risk factor, it could be family, so hereditary, can pass down and run through your family. Lifestyle, like not taking enough fluids, taking too much vitamin C or oxalates, etc. Medications, so particularly diuretics can cause kidney stones, and lastly, other conditions like UTI, which is the infections in the urinary tract. Symptoms, it can cause flank pain, so pain just in your flank area, and that it spreads down to your groin. You can be a bit nauseous and you can vomit as well. You might have bleeding in the urine, which you can't see because it's microscopic, but it will show up on a dipstick test. Whereabout is the location of the blockages. So this is your kidney. You have your ureter blockages. So if it's less than 5 millimeters, it can pass down quite spontaneously. If it's in the pelvis, it usually causes obstructions of the UPJ, which is the ureter-pelvic junction. And in the calyx, which mostly cause the flank pain and also the bleeding in the urine. Pathogenesis, how it comes about. So because of high saturation of the content, depending on the type of stones that you have, also dehydration, so not enough fluids running through your body, and crystal formations. Or you can have low inhibitory factors like citrates, which usually help with the solubility of the stones, and magnesiums and pyrophosphate. What do we do with the stones then? We have to investigate it. So we do blood tests, and then we do CT scan. After that, we do cup X-ray, which stands for kidney, ureter, bladder X-ray, to have a good look of these stones, and so we know what sort of procedure we're going to do. Ultrasound, sometimes they're used if the patients are young, in pediatrics, for example. Treatment-wise, it could be medically or interventionally. Medically, you can have analgesia, you can have NSAIDs, alpha blocker to pass down the stone, and then IV fluids if the patient vomits. And then we move on to intervention, which are usually like a procedure. For example, cystoscopy, ESWL and PCNL. They are methods or types of lithotripsy, which eliminate the stones inside the kidney. Thank you, and this is all for today. Do not forget to subscribe and like. Thanks.